Ladies and gentlemen, welcome to the International Conference Himc 2025, Health Innovations and Modern Challenges, Interdisciplinary Perspectives in Medicine and Healthcare, Anadolu University Faculty of Health Sciences, Anadolu, Turkey, where we gather to celebrate global innovations in modern science. Congratulations to all participants for their outstanding contributions and dedication to advancing knowledge in their respective fields. I wish you all a successful and inspiring conference, filled with productive discussions and groundbreaking discoveries. We invite Mrs. Husnunur Aslan Turk to speak. The topic of his speech is the views of social work academicians on distance education during the pandemic, challenges and opportunities.
The COVID-19 pandemic has transformed various aspects of education, pushing institutions to rapidly shift from traditional classroom-based teaching to distance learning methods. This study aims to investigate the perspectives of social work academicians regarding the distance education process during the pandemic. The research specifically focuses on understanding the challenges and opportunities they encountered while transitioning to and delivering education through online platforms. The findings are based on data collected from 42 academicians working as lecturers in the field of social work at different universities across Turkey. One of the primary findings of this study is the lack of prior training in distance or online teaching methods among most of the academicians. Before the pandemic, a majority of the respondents had not attended any courses, seminars, or training sessions related to the methods and technologies required for effective online teaching. This lack of preparation presented a significant challenge when transitioning to distance education. Academicians were forced to learn and adapt to new digital tools and teaching methods without prior experience or formal guidance, which created additional stress and difficulties in maintaining the quality of their courses. In terms of the challenges faced during the pandemic, the lack of infrastructure emerged as one of the most significant barriers. Many academicians struggled with unreliable internet connections, inadequate technical support, and insufficient access to the necessary digital tools to deliver their lessons effectively. These infrastructural issues not only hindered the teaching process but also created feelings of frustration among both educators and students. The lack of experience in online teaching methods compounded these issues, with many academicians finding it difficult to engage students and deliver content effectively through digital platforms. Furthermore, the time required to adapt to distance education was another key difficulty. Many academicians reported a lack of sufficient time to familiarize themselves with the new online teaching environment. This resulted in rushed lesson preparations and challenges in ensuring that course materials were appropriately adapted for online delivery. The time constraints also affected the overall quality of teaching, as academicians had to balance their responsibilities between transitioning courses online, managing administrative tasks, and addressing the technical challenges associated with distance education. Academicians also faced challenges in the delivery of both theoretical and applied courses. When teaching theoretical courses, the main difficulties arose from interacting with a large number of students through online platforms. The lack of face-to-face communication made it harder for academicians to gauge students' understanding of the material and address their questions or concerns in a timely manner. Additionally, assessment and evaluation processes became more complicated in the online environment, with some academicians struggling to maintain the same standards of fairness and effectiveness as they would in a traditional classroom setting. In the case of applied courses, the challenges were even more pronounced. Applied courses, which typically require hands-on learning and direct supervision, posed particular difficulties when delivered online. Academicians expressed uncertainty about how to effectively transform practical exercises into theoretical content suitable for an online format. Furthermore, the assessment of applied work, such as field placements or internships, became particularly challenging. The lack of direct supervision and the difficulty in observing students' practical skills made it hard to ensure the same level of learning outcomes as in face-to-face settings. Despite these challenges, several positive aspects of distance education during the pandemic were identified. One of the key strengths was the increased accessibility to education. Distance learning allowed students from different geographical locations to participate in courses without the need for physical presence, thus overcoming barriers related to travel or location. Additionally, the flexibility of online courses made it easier for students to access course materials and lectures at their own convenience. This not only increased the overall reach of the courses but also allowed for a more personalized learning experience. Another advantage highlighted by the academicians was the ability to enable active communication and interaction between students and lecturers through various online platforms. Tools such as discussion boards, video conferences, and live chats provided new avenues for engagement, which were not always available in traditional classrooms. These digital communication tools facilitated more direct and frequent interaction, which helped foster a sense of connection among students and between students and lecturers despite the physical distance. However, despite these positive aspects, most academicians pointed out that social work education, in particular, is not entirely suitable for distance learning. They argued that the hands-on, interactive nature of social work practice, which often involves face-to-face interaction with clients and communities, cannot be fully replicated through online education. As a result, many academicians concluded that distance education should be viewed as a supplementary method of teaching rather than a primary mode of instruction for social work programs. It was emphasized that distance education could serve as a valuable tool in extraordinary circumstances, such as a pandemic, but it was not seen as a sustainable long-term solution for the delivery of social work education. In conclusion, the study reveals a mixed perspective on the use of distance education in the field of social work. While the transition to online learning presented significant challenges, particularly related to infrastructure, lack of experience, and time constraints, it also brought about opportunities for increased accessibility and flexibility in education. However, the limitations of online education for fields such as social work, which require practical, hands-on learning, have led academicians to view distance education as an auxiliary tool rather than a permanent replacement for traditional teaching methods. As the world continues to grapple with the effects of the pandemic, it is essential to reflect on these experiences and consider how online teaching can be better integrated into the future of higher education in a way that balances both accessibility and the integrity of practical training.
We invite Mrs. Statkevičienė Karina to speak. The topic of his speech is Trends in the Prevalence of Myopia in Lithuania from to a population-based study.
Myopia, nearsightedness, is one of the most common refractive errors, characterized by the focusing of images in front of the retina rather than directly on it. This optical imperfection results from either an elongated eyeball or excessive curvature of the cornea or lens. Typically diagnosed before the age of 20, with the highest incidence between 6 and 14 years, myopia is influenced by a combination of genetic predisposition and environmental factors. With increasing global concern over the rising prevalence of myopia, understanding national trends is crucial for developing preventive strategies and mitigating its potential complications. This study aimed to assess changes in the prevalence of myopia in Lithuania over 2 decades, from 2001 to 2020, using national epidemiological data. The research utilized data obtained from the Institute of Hygiene, which tracks the prevalence of myopia classified under the ICD-10 code H52.1. The prevalence rates were calculated per 100,000 individuals, separately for children and adults. To determine trends in prevalence over time and analyze differences between age groups and sexes, joint point regression analysis was applied. By 2020, the overall prevalence of myopia in Lithuania reached 2,838 cases per 100,000 population. The burden of myopia was disproportionately higher among children, with a prevalence rate of 7,123 per 100,000, compared to 1,908 per 100,000 among adults. These findings suggest that myopia is primarily a childhood and adolescent condition, which may persist or stabilize in adulthood. Over the 20-year study period, the prevalence of myopia demonstrated a significant increase, nearly doubling in Lithuania. Notably, the average annual increase in prevalence was greater in children, 7.1% per year, p less than 0.001, than in adults, 2.4% per year, p equals 0.043, highlighting the growing burden of myopia in younger age groups. Between 2001 and 2005, the prevalence of myopia among children increased sharply, with an annual growth rate of 20.8%, p less than 0.001. However, from 2005 to 2018, the rate of increase slowed to 5.9% per year, p less than 0.001, but remained positive, indicating a continued upward trend. Interestingly, in 2020, a sudden decrease in the prevalence of myopia was observed, with a reduction of approximately 26% in adults and 16% in children. This decline may be attributed to the COVID-19 pandemic, which led to the closure of many healthcare facilities and a subsequent reduction in the diagnosis and registration of new myopia cases rather than an actual decrease in prevalence. Sex-based differences in myopia incidence were also observed. From 2001 to 2020, the average annual increase in prevalence was slightly higher among boys, 8.2% per year, than girls, 6.7% per year, p less than 0.001. Despite this difference in annual increase, the overall prevalence ratio of myopia between girls and boys in 2020 was approximately 1.3 to 1, p greater than 0.05, indicating a slightly higher burden of myopia among female individuals, although not statistically significant. The increasing prevalence of myopia over the past 2 decades reflects a broader global trend, where urbanization, increased screen time, and reduced outdoor activities have been implicated as key environmental contributors to the development of myopia. While genetic factors play a fundamental role, lifestyle changes, particularly those involving prolonged near-work activities such as reading and screen exposure, have been linked to the rising prevalence of myopia in children. The stabilization observed between 2005 and 2018 may be partially attributed to increased awareness and preventive measures, yet the overall upward trajectory remains concerning. The sharp decline in 2020 is likely an artifact of healthcare access disruptions due to the COVID-19 pandemic rather than a true reduction in myopia prevalence. During lockdown periods, limited access to ophthalmological services, delays in routine eye examinations, and potential underreporting may have contributed to this observed decrease. The pandemic itself may have exacerbated myopia progression due to increased screen exposure from remote learning and reduced time spent outdoors, which has been recognized as a protective factor against myopia development. These findings underscore the need for continued monitoring of myopia prevalence and the implementation of preventive measures, particularly targeting children and adolescents. Encouraging outdoor activities, regulating screen time, and promoting regular eye examinations could help mitigate the increasing burden of myopia. Furthermore, early detection and intervention remain crucial in reducing the risk of high myopia, which is associated with complications such as retinal detachment, myopic maculopathy, and glaucoma. In conclusion, the prevalence of myopia in Lithuania has demonstrated a significant upward trend over the past 2 decades, particularly among children. The observed decline in 2020 is most likely due to reduced access to healthcare services during the COVID-19 pandemic rather than a true reduction in prevalence. Continued public health efforts are necessary to address this growing issue, emphasizing preventive measures and early interventions to curb the rising prevalence of myopia and its associated complications.
We invite Mr. Himc Bosoito speak. The topic of his speech is the impact of cochlear implantation age and bilateral implant use on language, cognitive, and speech and noise perception in children with congenital hearing loss.
Cochlear implants (CIS) have significantly improved the auditory and linguistic abilities of children with congenital hearing loss (CHL). However, their efficacy varies depending on factors such as the age of implantation and whether children receive unilateral or bilateral implants. This study aims to compare the language, cognitive and speech and noise SIN perception abilities of children with CIS to those of their normal hearing NH peers. Additionally, it examines the impact of implantation age and the use of unilateral versus bilateral implants on developmental outcomes. The auditory experience plays a crucial role in shaping language and neurocognitive functioning. Severe to profound hearing loss (SPHL) negatively affects speech and language development and has broad implications for cognitive, motor, and social development. To mitigate these adverse effects, cochlear implants have been developed and optimized for pediatric users.
These devices significantly enhance language skills, cognitive functions such as memory and discrimination, and SIN perception abilities. However, various factors, including age at diagnosis, age of implantation, bilateral CI use, and parental involvement, influence post-implantation outcomes. One of the most critical determinants of CI efficacy is the age at which the implant is received. Auditory deprivation in early childhood alters synaptogenesis and neuronal pruning, which in turn affects neurocognitive development. Early intervention within the sensitive period is essential to prevent further deterioration of central nervous system maturation. Children who receive CIS early gain access to auditory information during critical developmental stages, leading to better language acquisition and cognitive function. The highest plasticity of the central auditory nervous system (CANS) occurs within the first 3 to 4 years of life, and prelingual hearing loss can impact its development significantly. Consequently, research suggests that earlier implantation results in improved language, cognitive, and SIN perception skills. Bilateral CI use is another key factor influencing outcomes. The human auditory system relies on binaural cues, including time, level, and spectral differences, for noise reduction and sound localization. While unilateral CIs support language development in bilaterally deaf children, they do not facilitate binaural processing. Thus, early and bilateral access to auditory input is crucial for the maturation of the auditory system. A lack of such stimulation may lead to neural development deviations that affect language acquisition and higher cognitive functions. In this study, 50 children with CIS and 20 children with NH, aged 6 to 9 years, were assessed for language, cognitive, and SIN perception skills. The study group was further divided based on the implantation period 12-18 months versus 19-24 months, and whether children had unilateral or bilateral implants. The analysis revealed that children with CIs performed significantly worse than their NH peers in all assessed domains, including language skills, verbal memory, verbal short-term memory, verbal working memory, rapid naming, and SIN perception. Additionally, children implanted between 19 and 24 months performed worse in rapid naming and verbal working memory tasks compared to those implanted between 12 and 18 months. This suggests that implantation within the earlier range provides better cognitive and linguistic outcomes. Comparisons between unilateral and bilateral CI users further supported these findings. Both groups performed worse than NH peers in all domains. However, children with unilateral CIS exhibited poorer SIN perception abilities compared to those with bilateral CIS. This underscores the importance of binaural auditory input in facilitating SIN perception and overall auditory processing. While bilateral implantation offers advantages in speech perception and cognitive development, it does not completely bridge the gap between CI users and NH peers. The findings of this study align with previous research indicating that cochlear implantation before 18 months results in superior speech recognition outcomes compared to later implantation. Studies have consistently demonstrated that delaying implantation beyond 24-36 months significantly reduces auditory and speech development benefits. Furthermore, while the advantages of bilateral implantation over unilateral implantation in SIN perception are well established, few studies have directly compared their outcomes with NH peers. The present study contributes to this literature by highlighting the persistent challenges faced by CI users, despite advancements in technology and early intervention strategies. Several factors may explain the persistent discrepancies between CI users and NH peers. One major limitation of CIS is that they do not fully replicate the auditory experience of normal hearing. CIS provide a limited frequency range and reduced temporal resolution, which can impact the development of complex auditory processing skills. Additionally, the auditory cortex of children with CHL may undergo different neuroplastic changes compared to NH children, even after early implantation. Another contributing factor is the variability in post-implantation intervention. While early implantation provides a neurodevelopmental advantage, continuous speech therapy and auditory training are crucial for maximizing language and cognitive outcomes. Environmental factors also play a significant role in the outcomes of children with CIS. Socioeconomic status, parental education levels, and access to specialized auditory training programs influence post-implantation success. In this study, differences in maternal and paternal education levels were observed between groups, which may have contributed to variations in language and cognitive skills. Furthermore, children receiving unilateral CIS often lack exposure to binaural auditory input, limiting their ability to localize sounds and process speech in noisy environments. Given these findings, clinical and educational interventions should extend beyond improving language skills to include cognitive training and auditory processing exercises. Strategies such as auditory verbal therapy, working memory training, and individualized educational support can enhance the overall development of children with CIS. Future research should explore the long-term cognitive and academic outcomes of early implanted children to refine intervention strategies further. In conclusion, cochlear implantation significantly improves auditory, linguistic, and cognitive skills in children with congenital hearing loss. However, children with CS still perform worse than their NH peers in language, cognitive, and SIN perception abilities. Early implantation within the first 18 months provides better outcomes than later implantation, and bilateral implantation offers advantages over unilateral implantation. Despite these benefits, CIS do not fully compensate for the effects of early auditory deprivation, emphasizing the need for comprehensive post-implantation support. Future intervention approaches should focus not only on enhancing language skills, but also on improving cognitive abilities to optimize the developmental trajectories of children with cochlear implants. We invite Mrs. Paulina Wasiuk to speak. The topic of his speech is assessment of IgGV mutation status, methodology, and reporting recommendations.
The evaluation of immunoglobulin heavy chain variable, IgHV, region mutations has become a fundamental prognostic and predictive tool in the management of chronic lymphocytic leukemia, CLL. This molecular marker plays a crucial role in stratifying patients into distinct risk categories and guiding therapeutic decisions before the initiation of first-line treatment. Understanding the methodology for IgHV mutation assessment and the standardization of reporting practices is essential for ensuring accuracy, reproducibility, and clinical applicability of results. IgHV mutation status is assessed using molecular techniques designed to determine the sequence variation within the variable region of the immunoglobulin heavy chain gene. The classification of IgHV genes as mutated or unmutated is based on sequence homology with the closest germline counterpart. A threshold of 98% identity to the germline sequence is commonly used to distinguish between mutated and unmutated IgHV status, with values below this cutoff classified as mutated. Patients with unmutated IgHV genes, 98 identity, typically exhibit more aggressive disease, higher rates of progression, and poorer responses to chemoimmunotherapy compared to those with mutated IgHV genes, 98% identity. The methodology for IgHV mutation analysis involves several critical steps. First, genomic DNA is extracted from peripheral blood or bone marrow samples, and the rearranged IgHV genes are amplified using polymerase chain reaction, PCR, with consensus primers targeting the variable, diversity, and joining regions. Following amplification, sequencing is performed using Sanger sequencing or next-generation sequencing, NGS, technologies. The obtained sequences are then aligned against reference databases, such as the IMGT, International Immunogenetics, database, to identify the closest germline match and determine mutation status. The accuracy and consistency of IgHV mutation assessment rely on adherence to standardized protocols. Laboratories performing IgHV sequencing must implement rigorous quality control measures, including appropriate primer selection, contamination prevention strategies, and validation of sequencing techniques. Bioinformatics tools used for sequence alignment and mutation analysis should comply with established guidelines to minimize variability in interpretation. The clinical significance of IgHV mutation status in CLL has been well documented in numerous studies. Unmutated IgHV is associated with an increased likelihood of requiring early treatment, resistance to conventional chemoimmunotherapy regimens, and a preference for targeted therapies such as Brutonase tyrosine kinase, BTK, inhibitors and B-cell lymphoma 2, BCL2, inhibitors. Conversely, patients with mutated IgHV typically have a more indolent disease course and respond favorably to fludarabine-based chemoimmunotherapy. As a result, IgHV mutation status has become a cornerstone in risk stratification models, alongside other prognostic markers such as TP53 mutations and DEL17P. Given the prognostic and therapeutic implications of IgHV mutation testing, standardization of result reporting is paramount. The recommendations provided by the Molecular Hematology section of the Polish Society of Human Genetics emphasize the need for uniform reporting formats that include comprehensive details on sample quality, sequencing methodology, alignment parameters, and interpretation criteria. Reports should clearly state the IgHV gene family used, the percentage of sequenced identity with the germline reference, and the final classification as mutated or unmutated. Additionally, any limitations of the analysis, such as low-quality reads or potential contamination, should be explicitly mentioned. The introduction of Polish recommendations for IgHV mutation testing aligns with internationally recognized guidelines, including those from the European Research Initiative on CL, ERIC, and the World Health Organization, WHO. These guidelines aim to enhance the reproducibility of IgHV mutation assessments across different laboratories and ensure that clinicians receive reliable and actionable data for patient management. In conclusion, the assessment of IgHV mutation status represents a vital component of modern CLL diagnostics, offering significant prognostic and predictive insights. The implementation of standardized methodologies and reporting recommendations will facilitate the integration of IgHV mutation analysis into routine clinical practice, ultimately improving patient outcomes. By adhering to internationally accepted protocols and quality control measures, laboratories can ensure the accuracy and reliability of IgHV mutation testing, enabling personalized treatment strategies for CLL patients.
We invite Mr. Vladimir Stefanov to speak. The topic of his speech is non-operative approaches in the management of gonarthrose S, current perspectives and future directions.
Gonarthrose, commonly referred to as knee osteoarthritis, is a chronic degenerative joint disorder that represents a significant public health challenge, particularly in aging populations. The disease is characterized by progressive cartilage degradation, synovial inflammation, and structural changes in the joint, leading to pain, stiffness, and reduced mobility. As the global population continues to age, the prevalence of gonarthrose is increasing, necessitating the development of effective treatment strategies that can alleviate symptoms and delay progression of disease. While surgical interventions such as total knee arthroplasty remain the definitive treatment for advanced stages of gonarthrose, non-operative treatment approaches play a crucial role in disease management, particularly in the early and moderate stages. These methods not only help in symptom relief but also contribute to preserving joint function and improving patients' quality of life. Among non-operative treatment modalities, pharmacological therapy represents a cornerstone in symptom management. Non-steroidal anti-inflammatory drugs, NSAIDs, are widely used for pain control and inflammation reduction. Both selective and non-selective NSAIDs provide significant relief. However, their long-term use is associated with gastrointestinal, cardiovascular, and renal side effects, necessitating careful patient selection and monitoring. Paracetamol is often recommended as a first-line analgesic, but its efficacy in managing gonarthrose-related pain is limited compared to NSAIDs. Opioids, although effective in pain relief, are generally reserved for patients who do not respond to other medications due to their potential for dependence and adverse effects. Intraarticular injections have gained substantial interest as a means of delivering targeted therapy directly into the affected joint. Corticosteroid injections provide rapid and effective pain relief by suppressing synovial inflammation. However, their effects are often short-lived, and repeated injections may accelerate cartilage degradation. Hyaluronic acid (HA) injections, commonly referred to as VISCOSUPPLEMENTATION, offer an alternative approach. HA is a key component of synovial fluid, contributing to joint lubrication and shock absorption. Exogenous HA administration aims to restore the viscoelastic properties of synovial fluid and provide symptomatic relief. Clinical studies have shown mixed results regarding HA's efficacy, with some demonstrating substantial improvements in pain and function, while others report only modest benefits. Nevertheless, injections remain a widely used treatment option, particularly in patients who are not candidates for surgical intervention. Biological therapies represent a promising frontier in the non-operative management of GONARTHROSIS. PLATLETRACH plasma, PRP, therapy has gained attention due to its potential to promote cartilage repair and reduce inflammation. PRP is derived from autologous blood and contains a high concentration of growth factors that facilitate tissue regeneration. Clinical evidence suggests that PRP injections can provide superior pain relief and functional improvement compared to high-end corticosteroids, particularly in younger patients and those with mild to moderate disease severity. Another emerging therapy is mesenchymal stem cell (MSC) transplantation, which aims to regenerate damaged cartilage through differentiation of stem cells into chondrocytes. While preclinical studies have demonstrated promising results, further LARGSCALE clinical trials are needed to establish the long-term efficacy and safety of MSC therapy in GONARTHROSIS treatment. Beyond pharmacological and INZECTIONBASED therapies, lifestyle modifications and physical interventions play a fundamental role in managing GONARTHROSIS. KINESATHRAPY, our therapeutic exercise, is one of the most effective non-operative approaches for improving joint function and reducing pain. Strengthening exercises for the quadriceps and hamstring muscles help stabilize the knee joint and reduce mechanical stress on the articular cartilage. Additionally, LOWIMPACT activities such as swimming, cycling, and Tai Chi have been shown to improve joint mobility and overall physical fitness without exacerbating symptoms. Supervised exercise programs tailored to individual patient needs are recommended to maximize therapeutic benefits while minimizing the risk of injury. Weight management is another crucial component of non-operative GONARTHROSIS treatment. Obesity is a WLLESTABLISHED risk factor for knee osteoarthritis, as excessive body weight increases mechanical loading on the knee joint and contributes to systemic inflammation. Clinical studies have demonstrated that even a modest reduction in body weight can lead to significant improvements in pain and functional outcomes. Dietary modifications combined with regular physical activity are essential strategies for achieving and maintaining a healthy weight. In some cases, medical or surgical weight loss interventions may be considered for individuals with severe obesity and comorbidities that limit their ability to engage in physical exercise. Patient education and SELFMANAGMENT strategies are integral to optimizing treatment outcomes in GONARTHROSIS. Educating patients about the nature of the disease, available treatment options, and the importance of adherence to prescribed therapies empowers them to take an active role in their care. COGNITIVBHADIORAL interventions, including pain coping strategies and psychological support, can also enhance patients' ability to manage chronic pain and maintain a positive outlook on their condition. The use of assistive devices such as knee braces, orthotics, and walking aids can further support joint stability and alleviate mechanical stress during daily activities. Despite the advancements in non-operative treatments, challenges remain in developing personalized treatment strategies that address the heterogeneous nature of GONARTHROSIS. Factors such as disease severity, patient age, comorbidities, and individual response to therapy must be carefully considered when selecting the most appropriate treatment approach. Future research should focus on identifying biomarkers that predict treatment response, optimizing combination therapies, and exploring novel regenerative medicine techniques to enhance cartilage repair. In conclusion, non-operative treatment approaches play a pivotal role in the management of GONARTHROSIS, offering symptom relief and functional improvement while delaying the need for surgical intervention. Pharmacological therapies, INTRAARTACULAR injections, regenerative medicine, KINESATHRAPY, and weight management collectively contribute to a comprehensive treatment strategy. Continued research and innovation are essential to refining these approaches and improving outcomes for patients with ZONARTHROSIS. By integrating multidisciplinary care and EVID and CBASED interventions, healthcare providers can enhance the quality of life for individuals affected by this debilitating condition.
So, we sincerely thank all participants of the Himc 2025, Health Innovations and Modern Challenges, Interdisciplinary Perspectives in Medicine and Healthcare. Special thanks to Mrs. Husnunur Aslanturk and Mr. Emikiz Bozoy from Anadolu University Faculty of Health Sciences Anadolu, Turkey, for organizing the conference. We invite everyone to our next conference. Thank you. See you soon.